Hello and welcome to Wellness Live. My name is Dr. Olivia Moses, and we are so happy to have you join us for today's session. Today, we are going to be talking about dental health. Now, our teeth, that is everybody's health issue, right? Every day we look at our teeth, we see other people's teeth. How do we keep this very important part of our body healthy? Well, we have an amazing speaker for you today. Her name is Dr. Shelly Withers, and she is the chair of our dental hygiene department here at Loma University in our School of Dentistry. And she has been here in the organization for 15 years. She is the perfect person to talk to us today about our teeth. So without further ado, I'd like to introduce you to Dr. Shelly Withers.
Hello, welcome and greetings from the School of Dentistry. I'm really excited to be with you all today and look forward to talking more about dental health. Hopefully we can answer some questions that you might have. I'll go ahead and share my presentation here. First, I'd like to start with what our goal is for this session. There are 5 objectives that I'd like to talk about, and the first is to explain the difference or the benefits, of exams and x-rays. That can often be a question that people have if they have a concern with their teeth. They wonder, what is the reason for needing to get this other exam and whatnot and x-rays before I can move forward with the care. So we'll talk about that. The next item is to know the difference between a gingivitis, which is inflammation of the gum tissue, and periodontal disease, which is an actual disease that has progressed to causing a loss of bone and supporting structures around the tooth. The next thing I like to do is discuss ways to find appropriate home care products. There are a lot of different things available on the market and ways to really tailor cleaning and home care for your own specific needs. So I'd like to share some of those with you and hopefully answer questions that you have about them. Then following question and answer session, we'll talk about the way our health of the mouth is related to the health of our bodies. There has been quite a bit of research that has been done and it is in progress looking at the relationship between the two. So I think it's very interesting to understand that. And then finally, we'll review tips that help prevent children and infants from getting decay in their teeth. So when I thought about the importance of having an exam and x-rays from a dentist, I thought when we look visually, it's sort of what you can see from a boat if you see the tip of an iceberg. The teeth that you see in the mouth, and cheeks, tongue, that's what you see visually. So it is helpful for finding maybe different types of problems that may present on the gum tissue or different types of sores or lesions. We can see certain areas of decay that form on the chewing surfaces of the teeth or around the gum line. But one of the things that's important to know is that the dentist and the dental team is responsible for the overall health of your mouth as well. So they really want to know what's happening above the surface and below the surface as well. So what x-rays will show us is what's happening in the teeth below the gum line and what's happening in areas we just can't see. So an example, I've given 3 here. If we take images of a patient's teeth, here we might see, in this case, there is either an extra tooth that this patient has that's never quite made it into the mouth, or there is a tooth that's missing. So that's one thing they can determine. Maybe that tooth will keep growing, maybe it won't. And if it's causing any pain, they can take care of that. And then the next, many of you know that the wisdom teeth or third molars at the very back of the mouth, sometimes they come in straight and there's no problem, but sometimes they come in at an angle behind the tooth ahead of it, the second molar. Sometimes they just get stuck. They can't continue growing and erupting into the mouth. And that can cause problems as well, with pain, with food getting caught down there. So it's really challenging to clean, and it can be really uncomfortable and possibly start additional infections around the tooth. So things like that can be visualized with x-rays. And then in this other image here, we can see with a trained eye that the bone that's between the teeth to support it should normally look like the bone around this tooth. But here you can see that it's darker and that there's something happening around that tooth. It's a premolar. We could find out further what that might be and get a consultation and see if it's something to be concerned about. Is it possibly a type of oral cancer, or maybe not? Maybe it's something like a cyst, which is a fluid-filled sac within the tooth. So we want to explore that and make sure everything's okay. Now, some of you may know what this type of image is. This is called a panoramic image, and it's really nice because it shows you all the top teeth on the maxilla and the bottom teeth on the mandible in one image. So this type of x-ray is taken by a machine that goes all the way around your head, and we can see everything from the roof of our mouth here. We can see the roots of the teeth, and if any teeth are twisted and possibly in need of braces to help straighten them out. But here you can see, as the arrows are pointing to, the fact that there's a dark area right here that doesn't have the same sort of structure in the bone. That's something that we would follow through with, we'd follow through with and make sure that it's not a bigger concern, some type of cancer. One of the things we are really careful about is doing head and neck exams and questioning patients to make sure that they don't have any sort of symptoms of something that's really severe. We try and catch things early and help people stay healthy. So the next thing I would like to talk about is the difference between gingivitis and periodontal disease. So as I mentioned before, gingivitis is a type of inflammation, where periodontal disease is an irreversible process that's happened when there's loss of bone that supports the teeth. So in this example, you can see first an example of healthy teeth and gum tissue. So we're looking for the gingiva and the gum to have a pink or natural pigmentation to them. That's excellent. If they're firm and they follow in a nice kind of flat pattern around the teeth, that's a really good sign. When a patient has gingivitis, that's caused by inflammation and bacteria and an infection that's starting in the gum tissue around the teeth. It's going to show up and present itself as red swollen gums. So you can see along here this red line. And you may also notice some bleeding after you brush or floss your teeth. So that is kind of a warning light, maybe in our car when they tell us it's time to change the oil. Our gum tissue is giving us an indicator that there's an infection starting. And the good news is that is reversible. That can be treated with good home care, with brushing and flossing, with different rinses that help target the bacteria. And so that's our hope, that we can address it when it's still reversible. Prevention is a huge part of what we focus on in dentistry and in dental hygiene specifically. So if for some reason a patient hasn't had access to care or just didn't know about these different changes in the mouth, it's possible that they could develop periodontitis. And within the US, of adults that have teeth, 42% have some form of periodontitis. And what happens in that case is they get recession of the gum tissue where it starts to go lower on the tooth, and it looks like the part of the tooth is sort of getting longer. That's because the gum tissue is getting lower. It's also possible to lose teeth as you get further along in the disease process. You may see that teeth change position or they move apart because there's not bone supporting. People experiencing periodontitis, may experience a bad breath or taste that they can't seem to get it to go away, no matter what rinses they use, how much gum they chew, how much they brush. And that's due to the fact that the infection has gone very deep under the gum tissue and creates bacteria and byproducts that cause an odor. So it can be treated through care and cleaning, very thorough cleaning at the dental office. So moving on to the next topic, it's helpful to know what types of home care products are available and to help you know that there are more than just regular toothbrush and floss if you have different needs that may not be addressed by those. So I'd like to take a look at these specific questions, and I'm happy to answer any other questions you may have. So let's break each of these down. So first of all, a toothbrush comparison. First, we have the manual toothbrush, and you can see, as in the picture as well, some of them have little angulations across the top that help fit along the teeth. Some are flat, and that's fine. Both of them work. It's all about using it and contacting the teeth and gently going up along the gum tissue. The benefit is that they're less expensive, and you can use a variety of techniques with them. You can use light pressure, you can use maybe a little bit more, but we always want to be careful not to use heavy pressure. And they should be changed every 3 months. One way to look for if a toothbrush is ready to be changed is if the bristles are coming out and they're splayed. So that's something that we want to pay attention to. Some of them have indicator bristles that are usually blue, and as that blue dye fades away, it lets you know that the toothbrush is getting closer to needing replacement. Other bristles are made of charcoal, so they'll be black and just a different type of cleaning. Now with power brushes, you can see some examples here, different shapes of the brush heads. And this one on the right has those black bristles made of charcoal. And some thought that that may help with stain removal as well. They're more powerful, so you want to be really careful because they're vibrating at thousands of cycles per second. We want to take good care of the hard tooth structure and the softer gum tissue that surrounds it. You can choose toothbrushes that rotate, as in this option, or sonic brushes. Some use a combination as well. And one thing that's neat is that they have timers or programs that can be attached to different apps that you can look at on your phone. So you can see a little timer that's in a circle, and it might go through, okay, you spent 30 seconds on this upper right arch, okay, and then move to the next upper left quadrant, and then 30 seconds on the lower left, and then the lower right. So that is helping you brush your teeth for a total of 2 minutes. And I'll tell you that we are humans, even in the dental profession. When I actually time myself for 2 minutes, I am oftentimes shy of that. And I had a wake-up call when I got to have my teeth cleaned at the school here, just to help one of the students. And they did a disclosing technique where it puts a red dye on the areas that might have some plaque that's still on the teeth. And full disclosure, I had brushed that morning, but it was quick and I missed along the gum line. So just goes to show, even with the best intentions and the best training, we can still benefit from some instruction and encouragement to use the right technique and to go for 2 minutes. So some of the options that are available for flossing your teeth and cleaning between them involve floss. There are different types of waxed and unwaxed flosses. Usually waxed floss is good when you have teeth that are really close together and you need to be able to get something between them, and you don't want it to get stuck or shred. So a waxed floss is really good. Sometimes there's thought that unwaxed floss, because it's not as smooth, it might help remove the plaque and the biofilm off the teeth a little bit better. But there's a personal preference. We get really happy with whatever the patient is using consistently. There's a synthetic form of floss that has been in production, and it's made of a blue kind of synthetic material with little ridges in it. And I find that works really well. And it also doesn't get stuck in contact, so that's good. Now, floss picks, this example up here on the right, that's another device that's really handy if you have a hard time wrapping floss around your fingers and fitting that in your mouth. There are some that have short handles on them as well as longer handles, so it's like a toothbrush, only it has this flossing apparatus at the end. That's very helpful for people that have limited dexterity or arthritis for whatever reason. If they have a hard time grasping floss, the floss, a floss holder like that is very helpful. And super floss is really nice if you have an area where there's been a tooth replaced. So in this image on the lower right, obviously we can't see the roots of teeth through the gum tissue, but this is a diagram to show a bridge that's been used to replace a missing tooth. Sometimes that can be hard to clean under, so there's something called super floss that has a length of floss, and then between it is a kind of a little sponge, the smallest sponge, and that cleans under this area here. We also want to try and get really well along the side of the tooth that is still there supporting it, because that's where a lot of buildup can occur. Then oral irrigators is another option as well. So Waterpik is one that's been around for quite some time, and there are other companies that also have them available and in travel sizes. So some have small travel water flossers. I know, I'm trying to remember, Sonicare, I believe, has one, and Burst Oral Care has one that is travel size, so you can place the water in a small compartment on the handle. Sorry, going backwards there. So it's up to each person's choice, but this is nice if you have areas where food gets caught and it's just hard. You notice every time you eat, this will flush between the teeth, and it's wonderful if the person has braces or orthodontics. However, I would say, is whenever possible, incorporate some physical plaque removal in the teeth, and we'll talk about that. But oral irrigators are really helpful to prevent from getting that infection and gingivitis. They're also really helpful for cleaning if the patient already has periodontal disease and bone loss and areas with spaces between the teeth. These interdental brushes that are at the bottom left of the screen, they're very helpful because you can choose the exact size that fits in the area that you need. So if you have a little bit of a small space between the teeth, you can use a small brush and just gently clean in there. They don't have any, they have a plastic coated wire around them, so they're safe to use in teeth and they don't damage the tooth structure. If you have two teeth where there's quite a big space between them, however it is, you can take one of those larger brushes and clean on each side of the teeth around the space. Now, in this slide, I just would like to show some different ideas and things that we recommend for patients at different stages of health. If a patient has healthy teeth and gums, then we recommend usually keeping them that way, having something to prevent decay, such as a fluoride. Sodium fluoride is a really popular product because it doesn't have potential for staining. It's really safe around fillings and different types of tooth colored restoration. Then they generally just pick the toothpaste of their choice and a soft brush of choice, and then a type of floss or something to clean between. I do want to make a note that in the past, medium stiffness or hard bristled brushes were recommended, but that's something that today we don't recommend. Before, it was thought that that would really help remove the products or the biofilm, but it turns out it ended up doing more harm than good. So if you weren't aware of that before, no worries. Just look for toothbrush bristles that have the soft label on them at the store. It may feel different, but it's going to help preserve your tooth in the long run. So if a patient has gingivitis, we still want to take care of those teeth and prevent decay, but we might recommend an antimicrobial rinse. And there are different toothpastes available now. One example is Gum Detoxify. It's intended to help address inflammation right along the gingival margin. And then soft toothbrush and some type of irrigator. If a patient has periodontal disease, then we're still addressing the teeth, and even more so because when you have recession, that creates another space on the tooth that's vulnerable to decay. So we might help them by getting a toothpaste with potassium nitrate if they have sensitivity. Also chlorhexidine and some other rinses that are meant to help reduce bacteria are available with the prescription. CT4 is another brand as well. And then if they need brushes, they go ahead and get that. So let's look at stain removal products and tips. We first want to think about where is the stain located, if it's on the surface of the tooth or if it's inside. What I mean by that is there's enamel on the outside of the tooth, which is hard and it's exposed to all of the things we eat. It can get hard calcium and mineral buildups that's called calculus. That also attracts stain, so that when a cleaning really helps. But there are products available with whitening ingredients such as charcoal or peroxide. And then it also helps to rinse with water after you eat color-rich food. So marinara sauce, curries, anything like heavily pigmented, like grape juice, purple grape juice, things like that. Try and rinse your mouth with water afterward. And then we recommend avoiding smoking due to the staining. There's also a lot of other health benefits from avoiding smoking. If it's inside the tooth and the dentin is stained a little bit more, the tooth appears more yellow than you'd like, whitening strips can help. And then there's also more advanced products that will whiten a little bit more quickly in the office. So the last thing I wanted to talk about when we're considering stain removal is just to remember that different products have different amounts of grittiness, sort of. I think of it almost like the equivalent of, say, sandpaper. So if you were trying to take a piece of wood that was just newly cut from a tree and you wanted to get that as smooth as possible to make a nice table, you would start with like a rough, coarse sandpaper, then you use a medium, then you'd use like a real I'm thinking soft and thinking of toothbrushes, but then you use the lightest abrasive sandpaper that you could find. So I'm encouraging you to remember that with teeth, it's okay for a little bit to use something that has a higher abrasivity, but be careful with the types that are really, really gritty and abrasive. I don't have any product that I'm recommending for or against, just to say, be thoughtful of that. And I'll tell you, I just talked with a colleague who said she's seen patients who use the baking soda that are supposed to be low abrasive, like a fine grit, and she's seen them wear away a lot of tooth structure. So using baking soda with a hard bristle brush is a combination of a way that you could use, you could still create damage without meaning to. Okay, I'm going to go ahead and stop sharing for a second. If there are any questions that I can answer, I would love to.
Thank you so much, Dr. Withers. That is such fantastic information, and I can't wait to get to some of the questions that have been coming through. So if you're watching us live, don't forget, you can ask Dr. Withers questions right now in the chat or the comments section. So you talked a little bit about the charcoal bristles, and you can buy charcoal floss. Is this really recommended? Is there evidence that we should spend the extra money for these kinds of products?
From what I've seen, and it's definitely an area I could dig into the research a little bit more, but it is more of a kind of a natural way to whiten, and I've seen good results with it. And one of the main things we look for as well is that it doesn't cause harm. So it's definitely worth trying and seeing if that product works well for you.
Okay, great. Well, let's get to some of these questions. How often should I replace my toothbrush? We're really getting into the, practical questions here.
Yes. So 3 months is the recommendation, but it can be replaced sooner. A lot of it is just monitoring the bristle health, so to speak. So if that's what I really love about these indicator bristles, and when that's available, that can be a helpful way to measure, because as they start to get lighter and lighter, you realize, okay, it's like knowing when to change a water filter or something for a pitcher. So if it's wearing out more quickly at 2 months, go ahead and get a new one, because that'll be the best for your teeth possible.
Okay, great. Another question we had is sugarless gum healthy for teeth?
Great question. So yes, sugarless gum is definitely preferable to gum with sugar in it. And then what's even like fantastic, you can find it, is gum with xylitol and different substitutes that will not cause more of a problem with decay. So one of the ones that has it, I know, is Icebreakers. It's the one that comes in a little container with the square cubes of gum. There are other brands as well, but if you look for that ingredient of xylitol, that can really be positive and helpful.
Great. Another question we have is, are there any benefits to mouth taping for oral hygiene?
Oh, to mouth taping. Is that similar to oil pulling? Is that what they're...
Let's go with that, because I don't know what the question...
Okay, I'm not familiar with mouth taping, but with oil pulling, that is something that's been looked into as well. And it's a process where you find a certain type of oil, whether it's like coconut oil or whatnot, and you swish it around in your mouth, and it helps reduce bacteria. One of the challenges with that, though, is compliance, because usually the length of time that it needs to be swished in order to get a good result is like 10 to 15 minutes. So imagine it's tricky to brush for 2 minutes.
Right.
So if we were going to do something like the oil pulling, it's possible with commitment, but it's an option for people who are looking for something more natural. yeah, it just takes time.
So we also have another question is mouthwash beneficial before or after brushing?
Ooh, well, like many things, I would say it's good just using it, period. My choice is, now there's different ways we can brush first and then floss, or floss first and then brush. There is support in the literature for both. So that's a personal preference thing. Me personally, I like to finish with mouthwash because it helps. I think, okay, I removed everything I can off the teeth, along the gum line, between the teeth by flossing. And then even, so for me, I like to use a tongue cleaner as well, because that's helpful in preventing bad breath and removing bacteria. So what I do is I remove everything that I can, and then I use that mouthwash at the end to get the cheeks and to leave my mouth just feeling really minty fresh. And I love, so I use an ACT mouth rinse. Like I said, I'm not a paid spokesperson or anything. I like that it has fluoride as well as a remineralization product. So I really love that. I love the flavor. So great question. I think that's probably a personal preference.
Okay, we are actually rounding out already to half an hour already.
Okay.
But what I wanted to do is ask you, do you have any tips for brushing and flossing?
I do, yes. And I happen to have a model here. So unfortunately, this was from one of our favorite docs who gave this to me, and so some of the teeth didn't make it. But so for brushing, one of the things we really want to focus on is basically taking circular strokes and aiming towards the gum line, if at all possible. So if you can see the difference between brushing back and forth, I'm getting most of the tooth, but I'm missing the area along the gum line. So that's really helpful. And it's more how we do it than the pressure. So always trying to get along the gum line. So you can do, there's a couple different ways. Gentle circles. There's also wiggles back and forth, okay? So see how those wiggles really help as well? The main thing that we're just trying to avoid is any of this, okay? That's a no-no. And then for getting the inside of the teeth, on the lower, you basically turn the toothbrush up so it reaches those teeth, and you take circular strokes or gentle back and forth, and that cleans along the whole tooth really well. And then we want to make sure to get those chewing surfaces because they have grooves and can collect bacteria and whatnot. And then for flossing, so we recommend about 18 inches. And then wrapping it around the middle finger. So I'll back up here just a little bit. Wrapping it around the middle finger. And then you can use the thumbs and the index fingers. So you're not sticking your whole hand in your mouth. I will try this here while I'm holding the model. Okay, so we're gonna basically go up along one tooth in a C shape. So wrapping around the tooth. Sure. So we want to clean and take vertical strokes up and down like that. Sorry, it's kind of hard with me holding it, but along the side of it. And we want to be really careful not to just pop it up between the teeth and wreck hurting or potentially hurt the gingiva. So that can be really helpful there. And yep, those are some of the main tips if you want to brush and floss like a pro.
Well, thank you, Dr. Withers. That's our first half. We are already after 30 minutes, but this is such an important topic. Why don't we just keep on going? So if we can get to your second half of your presentation, that'd be fantastic.
Okay, awesome. And I think that will be a little bit quicker too. So I will reshare here. And okay, did that show correctly for you?
Not quite yet. We're seeing your next slide and everything.
Okay. Okay, so let me swap displays. How about that?
It hasn't changed yet.
Okay, let's see. I'll stop sharing. Okay, how about that?
We are still looking at your, I think, speaker view.
Okay.
Let's see if you can swap displays. Click swap, click it. Yeah, let's see if that helps us at all.
Did that fix it?
No.
That's so weird. Okay.
But we can definitely get to the information maybe on the slide right now.
Okay. So, okay, Eric is going to help me with it. So we just wanted to talk about systemic related to periodontal disease. And as I was mentioning at the beginning, these are not necessarily saying that if you have high blood pressure, it will cause periodontal disease or the other way around. It's saying that there is a correlation. So there's a relationship that's found between them. So in this case, for patients with periodontal disease, it's found that it has been associated with the following heart diseases, such as heart attacks, high blood pressure, and then a very fancy word, atherosclerosis, which talks about the narrowing of the vessels between the heart and the brain. And interestingly enough, we can sometimes see those calcifications on our panoramic images. So the next one is diabetes. And basically, here's one where there is actually a bidirectional relationship. It means that if a person has elevated blood glucose, then it's also going to make it harder to control the periodontitis. And that if they have periodontitis or that the disease and loss of bone and infection, because that's going to have an effect on their ability to control their blood sugar. So what that means is it can be helpful if patients work as hard as they can to keep the blood glucose controlled and get care for the disease as well of the mouth. There's associations of higher A1C levels and sometimes worsened complications, and an increased chance of having complications when a patient has type 1 diabetes, which is usually something they're dealing with from birth. If we look at respiratory diseases, there have been associations that have been found between the gum disease and bone disease associated with asthma, with COPD, as well as pneumonia. And this may be due to the fact that inflammatory processes and bacteria and whatnot that's in the mouth is actually being breathed into the patient's lungs. When we look at patients who are pregnant, there have been studies that show when you have periodontitis during pregnancy, it may contribute to increased risk of preterm birth, low birth weight infants, and preeclampsia. Preeclampsia is a type of toxemia, and these are some symptoms that may be included, but I bolded nausea and headache because those are two of the symptoms that really warrant seeing a health. Those findings were a result of 23 really in-depth reviews of research. These last ones show that there may be an increased risk of developing rheumatoid arthritis when patients have periodontitis. And I think there again, it's the association with the inflammation and that process that's going on in the mouth that can also circulate through the bloodstream and maybe cause issues as well. In chronic kidney disease, there's a high rate of periodontitis in populations with chronic kidney disease, so that people with, more issues with the kidney disease are seeing a higher rate of periodontitis as well. There have been associations as well with cancers and dementia. So, like I said, there are always a lot of, there are other factors to consider. Not that having the periodontitis causes these issues, but they can be related. So because of that, I feel it's helpful to find ways, if we can, improve the health of the mouth, that it can make the health of the body even better. Now, the last thing that I would like to cover, and we should definitely talk a lot more about it, but we'll be concise. Basically, it's important when a baby is young that they visit the dentist by the time they turn 1 year old. That is some resources say by 6 months, but 1 is good. And when they're young, you want to gently clean the gums and teeth as they enter the mouth, and later help the child build those good brushing habits and cleaning between the teeth. Sing songs with them as they brush for 2 minutes. And then when you're visiting the dentist, see if sealants and fluoride might help. And when they're getting ready to go for a nap or going to bed, if it's a young child, make sure that there's water in the bottle and not milk, because that can leave carbohydrates and different things that lead to decay. So if your child did eat before they took a nap or went to bed, try to brush their teeth if they have it, or wipe their gums with a xylitol wipe first. And if a cavity is found, you want to fix it as soon as possible, because those baby teeth are actually the placeholders for that child's adult teeth. So when the baby teeth have decay and problems and need to be removed, as in the picture there, you can see those molars with a couple fillings in the dark area on top of the tooth. Those have decay. It's really important to get it repaired so that it protects the space for the permanent tooth coming in. And then finally, it's good to look for snacks that are low in sugar and not going to stick on the teeth after you eat them. So some good examples are apples, cheese, and nuts. Those are great options for kids when you're trying to figure out what to feed them. So that is all the information I wanted to share. And I just want to encourage you with Philippians 4:13 that we can do all things through Christ who gives us strength. Thank you very much.
Thank you so much, Dr. Withers. That was fantastic. Some practical things that all of us can actually incorporate into our lives right now today. And I loved how you ended this about, and we've talked a lot about this during Wellness Live and other speakers, is that our entire body is a whole system. We like looking at our heart or our hypertension in one box and then our teeth in another box, but it is all connected. Our mind, our body, our teeth, our body, everything is connected. And yes, it's good that we take care of our whole health. Here is what we try to promote here in Wellness Live. So thank you so much for all of your information today and for visiting us here on Wellness Live. And I want to thank you, all of our viewers as well, for joining us. And you don't want to forget our next speaker and miss our next speaker. Her name is Angela Lawless. She is one of our fearless leaders here at Loma Linda University Health. She's our Chief Financial Officer here at Loma Linda, and she will be talking to us about wellness in our finances. So you don't want to miss that session. So again, I want to thank all of you for joining us. My name is Dr. Olivia Moses, and we'll see you next time.